Radiation Safety for Dental Facilities, presented by Astarita Associates, Medical Physics Consultants. Some general information to get started. Radiation is often depicted as a mysterious, deadly force. In truth, there is nothing mysterious at all and has been studied for over 100 years since its identification in 1895. Radiation detection, measurement, and control are extremely common events, and they happen on a daily basis in most medical installations and research facilities. The more the public understands, the less frightening it becomes. As we know, radiation can be a very beneficial diagnostic tool. The radiation quantities and units most often utilized for radiation measurement are the Coulomb per kilogram, or Roentgen, which is the measure of radiation exposure in air, the Gray or rad, which is the amount of energy from any type of ionizing radiation deposited in any medium such as water, tissue, or air, and the sievert or rem, which is the biological effect of a rad. 1 Gray is equal to 100 rads, and 1 sievert is equal to 100 rem. Entrance skin exposure is the measurement of radiation output at the point of skin entry for an X-ray examination. Peak skin dose is reported in Gray or milligray. Effective dose is the measure of the potential harm from radiation and is reported in sieverts or millisieverts. Natural background radiation is the relatively constant low-level radiation from naturally occurring sources. These radiation sources can be the Earth, cosmic rays, and naturally occurring radionuclides found in the body. Background radiation levels vary. The levels may depend upon location, altitude, and the amount of natural radioactive material in the ground. The Andes Mountains of South America have the highest known natural background level of 1,000 millirem, or 1 rem per year. The Nuclear Regulatory Commission states that the average natural background in the U.S. is 310 millirem per year, or 3.1 millisieverts. Included in this slide are typical natural background levels. New York City is approximately 3 millisieverts per year, or 300 millirem. Denver is approximately 5 millisieverts per year, or 500 millirem. Grand Central Station is greater than 5 millisieverts per year, or 500 millirem. This is because of the granite walls. The Andes Mountains are approximately 10 millisieverts per year, or 1,000 millirem. As mentioned, the approximate natural background radiation, or the ubiquitous radiation dose in the United States, is 3.1 millisieverts, or 310 millirem per year. However, there are also man-made sources which account for an additional 3.1 millisieverts per year averaged over the population. The man-made component comes from medical procedures such as nuclear medicine, CAT scan, dental x-rays, radiology, as well as consumer products such as building materials, smoke detectors, tobacco, and even some ceramics. Including both the natural and man-made components, the total background in the United States is approximately 6.2 millisieverts per year, whereas 37% of that comes from radon and 36% is from medical procedures averaged over the populace. The yellow sections on the graph are the sources of natural background radiation. The blue sections represent man-made sources of radiation and their contributions to the total background level. There are no known proven carcinogenic effects from radiation levels in the order of magnitude comparable to background radiation. Typically, exposures received by the staff from diagnostic procedures fall well within background radiation levels. Medical procedures account for 36% of the total annual background radiation in the U.S. Although the radiation dose from these procedures are averaged over the population, each procedure may contribute more radiation to the individual patient. When relating radiation dose to the patient, comparing the dose with a known quantity such as natural background radiation is often helpful to relay fears and gain perspective. The term BERT stands for Background Equivalent Radiation Term and is now becoming more common in the literature when comparing radiation doses. A CT angiogram may result in a dose to the patient of 12 millisieverts. This is equivalent to 4 years of natural background radiation. In comparison, a chest X-ray is only 1/10 of a millisievert or 10 millirem, which is equivalent to only 10 days of natural background radiation. To gain some additional perspective, a flight from LA to London could result in a dose of 0.05 millisieverts. Although variable, due to the complexity of the procedure, a cardiac catheterization can yield doses over 260 millisieverts. Radiation therapy procedures are much higher, but the radiation dose is fractionated over time and localized, not a one-time whole-body irradiation event. Individuals working with radiation and radioactive materials are labeled occupational workers. The dose limits to occupational workers are higher than the general public because it is expected the worker will be exposed to a radiation dose as part of their employment. The limits are established well below the level where deterministic effects are seen, and the limits minimize the potential risk from stochastic effects. The annual whole body limit to an occupational worker is 0.05 sieverts or 5 rem. The lens of the eye may receive 0.15 sieverts annually, and the extremities may receive a dose of up to 0.5 sieverts per year. The limit is higher for extremities due to the lack of sensitive organs. To ensure occupational workers are not exposed to excessive amounts of radiation, personal monitors are used to assess the radiation exposure and are exchanged on a routine basis. The personal monitors simply measure the amount of radiation to which the person was exposed. The monitor itself offers no protection against radiation exposure. Personal monitoring is required when an individual is likely to exceed more than 1/10 of the yearly occupational limit, or 500 millirem per year. Monitoring is also required if an individual handles radioactive material or works in a high radiation area such as a radiation therapy treatment room. Therefore, it is usually unnecessary to monitor occupational workers who will not approach 1/10 the maximum permissible dose. Monitors are typically worn at the collar. Pregnant workers are to wear the badge at waist level to monitor fetal exposure. Be sure to know your local regulations and consult with your medical physicist regarding monitor use. There are 3 cardinal rules of radiation safety. They are time, distance, and shielding. A common term used in radiation safety is ALARA. This is an acronym for as low as reasonably achievable. With regards to radiation safety, our goal is to keep radiation exposure as low as reasonably achievable. It is through the ALARA principle we strive to maintain exposure to radiation as low as possible. One such method is time. Minimizing your time around an energized radiation source will reduce your overall exposure. The source of exposure will be the X-ray tube, and the X-rays will be scattered by the patient during the time the unit is actually emitting X-rays. It is important to work in a manner to safely complete the task at hand in the shortest amount of time. Another tool in the radiation safety arsenal is distance. Distance offers great protection from radiation. Radiation exposures follow the inverse square law. As you double your distance from a radiation source, your exposure is reduced by a factor of 4. Therefore, doubling your distance results in 1/4 of the radiation exposure. The inverse square law, shown in the diagram, can calculate your reduction in exposure by moving away. Simply, if you double your distance, you quarter your exposure. If you triple your distance, you receive 1/9 the exposure, and so on. Although the technologist taking the X-ray is in a predetermined position, the immediate area should be cleared of personnel to keep their exposure low. In general, technologists performing dental X-rays should try and maintain a distance of 6 feet or stand behind a protective barrier. Shielding is the third component of radiation safety. To keep exposures as low as reasonably achievable, technologists should stand behind a protective barrier if available. A radiation protection survey is performed by a medical physicist or other qualified personnel to ensure the safety of the staff in the surrounding areas. Some dental facilities, due to their workload or the size of the room and the use of the surrounding areas, may not need additional shielding for the dental rooms. However, other units, such as cone beam dental CTs, may need additional shielding. Either way, a medical physicist should evaluate your X-ray installation. The number one priority is to protect the health and safety of the individuals who are subject to radiation exposure, whether they be the staff or the patient. All radiation exposures must be justified in relation to their benefits. The benefit of an exposure must outweigh the risk. All exposures must be kept as low as reasonably achievable while achieving a diagnostic image. Doses received by the patient and personnel must be kept well below allowable limits. Occupationally exposed personnel must not hold the patient during exposures. Also, the image receptor must not be held inside the patient's mouth and subject the holder's hand to the primary X-ray beam. Because there are small amounts of leakage radiation outside of the tube housing, the X-ray tube housing or the X-ray cone must not be held during an exposure as well. No personnel should be in the direct path of the X-ray primary beam, and as mentioned, remain at least 6 feet from the patient being radiographed. Quality control procedures and service preventative maintenance are important parts of ensuring the unit is in safe working order. These tasks should be performed in a timely manner and recorded when necessary. Any person that will be using the X-ray equipment should have the proper credentials and training to avoid unnecessary exposures. Tube head stability should also be checked routinely. Stability will prevent repeats and therefore unnecessary exposure to staff and patients. If your facility has or is interested in a cone beam C2 unit, the location may need additional shielding and QA requirements. A medical physicist should be consulted prior to install. Training documentation of all individuals should be maintained. It may be a requirement depending upon where your facility is located. Thank you for participating. Please be sure to print out your self-attested certificate. If you have any questions or comments, you can direct them to Astarita Associates. Thank you.